HLAs. What are HLAs? Human leukocyte antigen. Human leukocyte antigen. HLAs are the markers on your cells. They are the antigens which your leukocytes or the WBCs identify as self-antigens. HLAs. If the immune system identifies some of these HLAs as foreign and starts attacking it, then it is autoimmunity. Autoimmunity is an aberration. Why does it happen? We don't know. We don't know why autoimmunity happens. How do you treat it? You don't have specific mechanisms of treating autoimmunity. You will just do immunosuppression. You will suppress immunity. Alright. Which is not an effective way. Counter views about it is you have to strengthen the immune system. Autoimmunity is in one perspective is said to be the result of a weakened immune system. So if your immune system becomes optimally functional, autoimmunity can get spontaneously reversed is a theory. But why does autoimmunity happen and how do we definitively treat it is yet to be achieved. Alright. Memory-based acquired immunity evolved in higher vertebrates based on the ability to differentiate foreign organisms, example pathogens, from self-cells. While we still do not understand the basis of this, two corollaries of this ability have to be understood. One, higher vertebrates can distinguish foreign molecules as well as foreign organisms. Most of the experimental immunology deals with this aspect. Two, sometimes due to genetic and other unknown reasons, the body attacks self-cells. This results in damage to the body and is called autoimmune disease. Rheumatoid arthritis, which affects many people in our society, is an autoimmune disease. What is, anything that ends with itis refers to inflammation. Itis refers to inflammation. Cellulitis, inflammation of the cells. Tonsillitis, gastritis, inflammation. Itis refers to inflammation. What is before that tells you where the inflammation is. Arthritis, arthropoda. Arthro refers to what? Joints. Arthropoda is jointed legs. Poda is refers to legs. Arthritis means inflammation of joints. Inflammation of joints we have seen in musculoskeletal system. There are different ways by which inflammation can happen. Joint inflammation can happen. Different types of arthritis. Can you recall? Osteoarthritis. Osteoarthritis is because of damage to the bone. Because of damage to the bone. Rheumatoid arthritis, autoimmune disease, where the synovial fluid is attacked by the synovial tissue is attacked by the immune cells, causing inflammation. How do you treat it? Steroid injections, steroids. Steroids have an immunosuppressing action. So steroids are the primary immunosuppressing drugs. If steroids are not working, then you have specific immunosuppressants which will suppress the T lymphocytes, which will suppress the basically you have to suppress the cell-mediated immunity, not the non-specific immunity. Autoimmunity is caused because of cell-mediated immune system malfunction. It's not a solution. It's not a solution. It's like a child is hyperactive. You are not able to manage that child, so you are drugging that child to become sedate. The child has become less active. The child's hyperactivity has come down, but not because you have taught the child how to manage the excitement levels, but because you have suppressed the child. Okay. Can't help, that is how we can deal with it right now. There is one more autoimmune disorder which affects the skin cells. Pigmentation on the skin cells. Melanin producing cells are attacked by the immune system, causing depigmentation of skin. White patches on the skin. What is that disease? You will find many people have this. Vitiligo. Vitiligo is treated by localized steroid treatment. With patients of vitiligo are given topical steroids first. If it gets corrected, excellent. If it doesn't get corrected, keep taking systemic steroids. Problem with systemic steroids is that will suppress the If you continuously take steroids, what will it suppress? It will suppress the adrenal cortex. Adrenal cortex is suppressed, then adrenal problems will arise. So it's all, anything goes wrong and you try to treat that alone, that treatment has some other consequence. So it's a limitation of piecemeal approach to health. Piecemeal approach is you are treating only that problem. You have to treat the entire individual. So in treatment, holistic treatment always involves treating the individual and not just the disease. So when you go to a good doctor, the good doctor will always suggest you lifestyle modifications, whatever lifestyle modifications need to happen. In that lifestyle modifications, dietary recommendations and treatment. Treatment is to overcome the immediate challenge. Lifestyle modifications and dietary modifications to ensure that the progression towards better health is continuous. Okay. Immune system in the body. The human immune system consists of lymphoid organs, tissues, cells and soluble molecules like antibodies. As you have read, immune system is unique in the sense that it recognizes foreign antigens, responds to these and remembers them. The immune system also plays an important role in allergic reactions, autoimmune diseases and organ transplantation. See, the entire immunity is managed by WBCs. Entire immunity is managed by WBCs. Where are they produced? Where are WBCs produced? In the bone marrow. After they are produced, they have to be trained. Specific immune cells, T lymphocytes and B lymphocytes are the specific immune mediators. They have to be trained. B lymphocytes are trained in the bone marrow. B refers to what?
Bone marrow.
Not exactly. When it was discovered and studied, B referred to something in birds. What in birds? B refers to bursa of Fabricius. Fabricius. Bursa of Fabricius. That was the bursa in which B lymphocytes got trained. Birds have that. But in human beings, we don't have the bursa of Fabricius. We have our bone marrow training the B lymphocytes. So all the genetically developed antibodies are given to these B lymphocytes by the bone marrow. Okay. T lymphocytes are trained in thymus. So production in the bone marrow, training in the thymus and bone marrow respectively for the B lymphocytes and T lymphocytes. Various WBCs, these lymphocytes, all of them have to be available. They are in circulation. They are in circulation in the blood. But whenever there is an injury or whenever there is an infection, the availability of these cells should be immediate. They have to be available immediately in large numbers. Correct? So you have to concentrate these cells and position them in various places in the body, across the body. What are these locations where these are positioned? Lymphoid organs. Lymphoid organs are like, so you see, you can consider the population to be the source of your defense personnel. That is the bone marrow, where they come from. They go into defense academies for training. Primary lymphoid organs, bone marrow and the thymus. They get trained. After you train the defense personnel, what do you do with them? Will you send them back home? What do? You station them in different stations across the country. And you have, you can consider a different highway network for these people to move around. Alright? So for these people to move around. So the stations for these defense personnel to get stationed throughout the country are the lymphoid organs. Lymph nodes and all the other tissue associated lymphoid tissue. Like in the gut you have gut associated lymphoid tissue, GALT. In the respiratory passages or in the mucosal lining you have mucosa associated lymphoid tissue. Likewise different specific locations. In the nostrils, in the nose you have, what do you have in the nose? Adenoids. In the oral cavity you have tonsils. Here you have tonsils. in the nose you have adenoids, and throughout the body you have lymph nodes. Throughout the body you have lymph nodes. Clear? That's all. In intestines you have one specific kind of lymphoid aggregates. What are they? Lymphoid tissue. Pairs, patches. Pairs, patches. These are all secondary lymphoid organs. Primary lymphoid organs are those in which the lymphocytes are trained. So there are two primary lymphoid organs. What are they? Bone marrow and thymus. Secondary lymphoid organs are those in which the immune cells or the lymphocytes are stored. The extensive network of lymph nodes, adenoids, tonsils, mucosa associated lymphoid tissue throughout the body wherever you have mucosa. Specifically in the intestines you have Peyer's patches. And other than Peyer's patches also you have some lymphoid masses found. They are called gut associated lymphoid tissue, GALT. And the biggest secondary lymphoid organ is the spleen. Biggest lymphoid organ, secondary lymphoid organ is the spleen. Is that clear? Spleen has a lot of storage of these lymphocytes. Okay. And you have for the movement of these lymphocytes, the entire lymphatic pathway. You have lymphatic vessels, lymphatic organs for the entire for covering the entire body and be available for response whenever there is a challenge. So this is our defense system. This is our defense system. Is that clear? Lymphoid organs. These are the organs where origin and or maturation and proliferation of lymphocytes occur. The primary lymphoid organs are bone marrow and thymus, where immature lymphocytes differentiate into antigen sensitive lymphocytes. After maturation, the lymphocytes migrate to secondary lymphoid organs like spleen, lymph nodes, tonsils, Peyer's patches of small intestine, and appendix. Appendix is also a lymphoid organ. The secondary lymphoid organs, apart from these, we also discussed a few others, mucosa associated and gut associated lymphoid tissue. Adenoids have they given here? Adenoids also they have not given. Adenoids also you have to consider. Adenoids are in the nose. Okay. For constant running nose, constant allergies can lead to adenoiditis, like tonsillitis. Adenoiditis can also be the reason of perpetual blockage of the nose. The secondary lymphoid organs provide the sites for interaction of lymphocytes with the antigen, which then proliferate to become effector cells. The location of various lymphoid organs in the human body is shown in figure 7.5. Lymph nodes are present throughout the lymphatic network. Lymphatic vessels. You have the vessel and there is a lymph node. You have a vessel and there is a lymph node. Throughout the network of lymphatic vessels, you have lymph nodes. Various places. They are like police stations. Alright? These are all like headquarters. These are special cells. Like CBI, CCB, special offices. Lymph nodes are like general police stations. You will have police station within a few kilometers of any place you are there. Wherever you are there in the country, within a few kilometers you have access to a police station. Yes or no? That is how the police station network is designed. Whether it works or not, that's a different story. But police stations are there. Unlike our body where it works. Okay? In our body it works. If it doesn't work, then you will have a dysfunctional system. Diseases will happen. The bone marrow is the main lymphoid organ where all blood cells including lymphocytes are produced. Thymus is a lobed organ located near the heart and beneath the breastbone. That is the sternum. Sternum is called the breastbone. Clavicle is called the collarbone. Scapula is called the shoulder blade. Scapula is the shoulder blade. Okay. Thymus is quite large at the time of birth but keeps reducing in size with age, and by the time puberty is attained it reduces to a very small size. Both bone marrow and thymus provide microenvironments for the development and maturation of T lymphocytes. Spleen is a large vein-shaped organ. It mainly consists lymphocytes and phagocytes. It acts as a filter of the blood by trapping blood-borne microorganisms. Spleen also has a large reservoir of erythrocytes. See, in the intrauterine life, first organ to start producing blood is liver. Liver will start producing blood when the baby is developing in the intrauterine life. Then bone marrow picks up. Then spleen also is capable of producing blood in the intrauterine life. But after the child is born, spleen and liver stops producing blood. They don't continue their blood production function. Bone marrow continues to produce blood. All the bone marrow, so that is bone marrow of all the bones will be producing blood at birth. But as you start growing, it is the bone marrow of long bones and flat bones that will produce blood. Short bones will not produce blood. Long bones and flat bones are the only ones which will produce blood, bone marrow. If bone marrow fails, if there is bone marrow failure, liver can regain its blood formation function. Liver can take over the function of blood formation. Spleen cannot. Alright, if liver also fails, keep transfusing blood. If that is also not enough, anyways, nobody is designed to live eternally. Everybody has to die someday. All the best. Happy children. Alright. Nobody can stay forever. No? You can keep repairing whatever can be repaired if it's not possible. Lymph nodes are small solid structures located at different points along the lymphatic system. Lymph nodes serve to trap the microorganisms and other antigens which happen to get into the lymph and tissue fluid. Antigens trapped in the lymph nodes are responsible for the activation of lymphocytes present there and cause the immune response. So, where do the antigen presenting cells carry the antigens to? They carry the antigens to the nearby stations. That is the lymph nodes or the lymphatic organs. There is lymphoid tissue also located within the lining of the major tracts, respiratory, digestive and urogenital tracts, called mucosa associated lymphoid tissue. It constitutes 50% of the lymphoid tissue in the body. Okay. There are specialized phagocytic cells in the liver. Anybody can recall that? Specialized phagocytic cells in the liver.
Dust cells. Dust cells.
What?
Dust cells.
Kupffer cells. Alright? Kupffer cells you can remember. Kupffer cells are associated with liver. Some glial cells in the brain, some glial cells in the brain also are phagocytic in nature. Alright? AIDS, acquired immunodeficiency syndrome, means deficiency of immune system acquired during the lifetime of an individual, indicating that it is not a congenital disease. Syndrome means a group of symptoms. We have already discussed that. AIDS was first reported in 1981 and in the last 25 years or so, it has spread all over the world, killing more than 25 million people. See, HIV is supposed to have crossed the species barrier. First assumed to have developed in monkeys. First assumed to have developed in monkeys. It has crossed the species barrier somehow and it has transitioned into human beings. Alright. More than 25 million people have died because of it. AIDS is caused by the human immunodeficiency virus, a member of the group of viruses called retroviruses, which have an envelope enclosing the RNA genome. Transmission of HIV infection generally occurs by sexual contact with infected person, by transfusion of contaminated blood and blood products, by sharing infected needles as in the case of intravenous drug abusers, and from infected mother to her child through placenta. When later stages of pregnancy, during delivery. Before that, it can't cross. Before the terminal stages of pregnancy, end stages of pregnancy, when the placenta actually breaches, there is no transmission. Transmission cannot happen. Crossing over of these viruses cannot happen. It cannot cross the placental barrier. So, it is not necessary that a HIV infected mother should not have a child. She can have a child. It has to be planned in a way that the child does not reach the terminal stages of pregnancy. After 28 weeks, the child has to be delivered carefully through a cesarean section. If the child is delivered through a cesarean section, the child is likely to be safe. Alright, a HIV affected mother can still have a healthy baby. But there are possibilities of transmission. Now see, it's when the baby is being delivered, the fluids in the placenta, the mother's fluid will also be likely to get into the baby. If there is some small injury that happens to the baby during delivery, you are likely to transmit the infection. So very carefully the baby has to be delivered to ensure the baby is not infected. So people who are at high risk of getting this infection includes individuals who have multiple sexual partners, drug addicts who take drugs intravenously, individuals who require repeated blood transfusions, and children born to an HIV infected mother. Do you know when do people need repeated blood transfusions? When do people need repeated blood transfusions? Can you tell some conditions? Thalassemia, maybe sickle cell anemia, purpura, the blood cell conditions where the blood cells become defunct frequently. Spirocytosis, when the person's RBCs are spherical and they are more likely to be broken down. So in conditions where the RBCs are more likely to be broken down more frequently than its lifespan, then you will have to give repeated blood transfusions. It is important to note that HIV or AIDS is not spread by mere touch or physical contact. It spreads only through body fluids. It is hence imperative for the physical and psychological well-being that the HIV or AIDS infected persons are not isolated from family and society. A person with AIDS is at a risk of infection from others than the person becoming a risk of infection for the rest of the people. Why? Immunodeficiency. What we are generally immune to, those AIDS infected people are not immune to. They can develop opportunistic infections. What are opportunistic infections? What are opportunistic infections? Let's say you are a shopkeeper, you are a baker running the best bakery in town. You make amazing sweets and bakery products. There is somebody always at the counter to watch who comes in and who takes what and to collect the money for that and all that. If there is nobody at the counter, or if the person at the counter is sleeping, what is likely to happen? People will come, take what they want, come to the counter, the person is sleeping, keep the money there and go. That is what they do. What they do? They will just steal. So the person who is stealing when somebody who is stealing when the person in the counter is sleeping, is he a professional thief? What would you do? Now what would you do? Do you get tempted to steal? Be honest. Have you never done that? When somebody is not watching, pick up something and feel so good about it. Huh? Have you done it? If you have done it, are you a thief? Professional thief? No. You are an opportunistic thief. If there is an opportunity and then there is no likelihood of consequence, you want to try. It's a tendency. It's an evolutionary drive. You know, when there is an opportunity to have access to resources at low cost or no cost, your instinct kicks in and your intellectual training, social conditioning will be pushed back. That is why it is important to have rules. It is important to have monitoring. In a society where there is no monitoring or there are no rules, people are likely to become more instinct driven. There are no consequences. So opportunistic infections are those when the immune system is normally functioning, these organisms cannot cause any disease. But when the immune system becomes weak, such organisms which are not capable of producing disease in a normal individual will start causing disease. Kaposi sarcoma is one such cancer that develops. Alright, and there are some pneumonias which will develop in HIV infected individuals, which cannot happen in normal individuals. There is always a time lag between the infection and appearance of AIDS symptoms. This period may vary from a few months to many years, usually 5 to 10 years. After getting into the body of the person, the virus enters into the macrophages where RNA genome of the virus replicates to form viral DNA with the help of the enzyme reverse transcriptase. Retroviruses are the enzymes which will convert RNA into DNA. This viral DNA gets incorporated into host cell's DNA and directs the infected cells to produce virus particles. The macrophages continue to produce virus and in this way acts like a HIV factory. Macrophages will become like an HIV factory. Simultaneously, HIV enters into the helper T cells, T lymphocytes, replicates and produces progeny viruses. The progeny viruses released in the blood attack other helper T lymphocytes. This is repeated, leading to a progressive decrease in the number of helper T lymphocytes in the body of the infected person. During this period, the person suffers from bouts of fever, diarrhea and weight loss. Due to decrease in the number of helper T lymphocytes, the person starts suffering from infections that could have been otherwise overcome, such as those due to bacteria, especially mycobacterium, viruses, fungi and even parasites like toxoplasma. The patient becomes so immunodeficient that he or she is unable to protect himself or herself against these infections. A widely used diagnostic test for AIDS is ELISA, enzyme-linked immunosorbent assay. Treatment of AIDS with antiretroviral drugs is only partially effective. They can only prolong the life of the patient but cannot prevent death, which is inevitable. Alright. They cannot prevent death, which is inevitable. What can prevent death and when is death not inevitable? Death is always inevitable. The moment life is conceived, it is a countdown. You don't know how long your metabolic clock ticks. Everybody has a countdown that begins at the time of conception. When the zygote is formed, the countdown begins. So whose clock stops when? Nobody knows. That's all. HIV accelerates death. It will prevent the mechanisms which will help you stay healthy, therefore increasing the risk of early death. Increasing the risk of early death due to breakdown of physiological mechanisms. Prevention of AIDS. See here, there are markers. There are markers called cell differentiation markers that you find on every differentiated cell. Cell differentiation markers are found on every cell of a particular kind. So all the helper T cells, these are labeled with CD markers, cell differentiation markers. These are all our nomenclature. There is no alphabets there. Some proteins there you can consider on the cell membrane. Helper T cells are referred to as CD4 cells. That is cell differentiation marker 4. Killer T cells are referred to as CD8 cells. They have cell differentiation marker number 8. In our list of markers, the marker number 4, cell differentiation marker number 4 is present on helper T cell. 8 is present on killer T cell. HIV affects CD4 plus cells. Questions can come. Instead of mentioning helper T cell, the question can come with cell differentiation marker numbers. So HIV affects CD4 plus cells. Plus means those cells which have it present, CD4 present on the cell. As AIDS has no cure, prevention is the best option. Moreover, HIV infection more often spreads due to conscious behavior patterns and is not something that happens inadvertently, like pneumonia or typhoid. So HIV infection doesn't happen just like that. HIV infections happen by contact with an infected body fluid. Contact with an infected body fluid. If unfortunately blood transfusion or some accidents or something, blood transfusion leads to behavioral, multiple sexual partners, drug abuse, all these are behavioral patterns. Of course, infection in blood transfusion patients, newborns from mother etc. may take place due to poor monitoring. The only excuse may be ignorance, and it has been rightly said, don't die of ignorance. In our country, the NACO, National AIDS Control Organization, important you have to remember this organization, it can be a question. And other NGOs, see anything that has significance for current societies are important for exams. NACO is very important, National AIDS Control Organization. Are doing a lot to educate people about AIDS. WHO has started a number of programs to prevent the spreading of HIV infection. All these United Nations and its institutions have become useless. It just remains as an archaeological institution. United Nations has got no influence on the world anymore. Alright, India has almost 1/7 of the world's population. India has 1/7 of the world's population, the 5th largest economy, one of the biggest markets, the biggest market in the world, major player in the decision making of the world. But India is not a member of Security Council. How? Who decides? There are 4 or 5 countries which at one point of time used to think they are the big players in the world, and they continue to hold the control of United Nations when they are no longer in the league of powerful nations. Okay, so the entire African continent is not represented in the Security Council. India is not a part of Security Council. So who decides?
First world countries. First world countries.
So-called first world countries. Okay. Who are all the members of the Security Council? US, China, UK, Russia, France, I suppose. Permanent members. India is given an observer position. Why? To observe how these people do drama. So, we need to know, Indians rule the world. Most intellectual. They are positioned everywhere. They are the ones who are driving a lot of innovation across the world. But still, there is this racial supremacy that people feel, which we have to fight off record. Okay. No, your work, your intellect, everything should be aligned to the welfare of the nation. If you are intellectual, if you are intelligent, if you are well-read, competent, capable, that should translate into some utility for the nation, meaning people. If it is not useful to the nation and the people of your country, then useless. If it is only used to make money for your own lifestyle. You need to have money for your lifestyle, but your work should contribute to the welfare of the country and your own people. The welfare of the world peace, all of that is good on a beauty pageant stage. I want to work for world peace. Start with the country. Anyways. So, making blood from blood banks safe from HIV, ensuring the use of only disposable needles and syringes in public and private hospitals and clinics, free distribution of condoms, controlling drug abuse, advocating safe sex and promoting regular checkups for HIV in susceptible populations are some such steps taken. Earlier, hospitals and clinics used to use reusable needles. Reusable needles. Have you ever come across hospitals using reusable needles? The steel needles used to be used. Syringes also used to be glass syringes, not the use and throw plastic syringes. So that would be sterilized in boiling water and then reused. Now, mostly nobody uses reusable needles and syringes. Everybody uses disposable needles and syringes. Infection with HIV or having AIDS is something that should not be hidden. Since then, the infection may spread to many more people. HIV or AIDS infected people need help and sympathy instead of being shunned by society. Unless society recognizes it as a problem to be dealt with in a collective manner, the chances of wider spread of the disease increases manifold. It is a malady that can only be tackled by the society and medical fraternity acting together to prevent the spread of the disease. Not only HIV, any problem that affects the society needs a collective action. Awareness and action. Interventions to prevent further spread of any problem, further increase in any problem. Cancer. What is cancer? Simply put, cancer is the cells not knowing when to stop multiplying. That's all. Cells have the ability to multiply. There are forces. One important factor that will determine how much the cell should multiply is called, can anybody tell me? Contact inhibition. Contact inhibition. That means a cell is a part of a particular tissue space. If there is damage to the tissue leading to death of some cells, there is space created in that tissue which needs to be filled up by new cells. The cells around that will lose contact with the surrounding cells because the cells died. So if you are in a group of 10 people standing in a particular closed compartment, you are experiencing some contact with the other people. When 2 or 3 people leave that space, the contact becomes lesser. When more people come into that space, you know the contact has become complete. So it's like a lift which can accommodate 6 people. Even if you are closing your eyes, even if all the people in the lift are blindfolded and they are made to stand inside the lift. Let us say 6 people is the capacity of the lift. That is for people to stand comfortably. We make 10 people get into the lift. So you are all in contact with each other. The lift opens, you are closing your eyes. Few people get out. And the same size people come in. Will you be able to tell when the exact number of people who got out have come in? If 4 people gets out, you are blindfolded. People are coming in one by one. When the same size 4 people come into the lift, will you be able to make out that the number of people who went out have come back in? Yes or no? You can't make out? You can make out. Because let's say somebody is just in contact with your shoulders. This is the position you are standing in when all the people are positioned inside the lift. Few people get out, so your shoulder relaxes. When the same number of people come in, your shoulder gets back into the same position of compressed shoulders. If more people come in, you feel more squeezed. So you know there are more people who have come in. What will you try to do? You will try to push them out. You try to push them out so that you come back to that position of just about sufficient number of people. This is contact inhibition. If more and more people try to squeeze in, making your body get squeezed, what will you do? You will push. You will not let more people come in. This is what cells do. The cells have the ability to identify how many cells are supposed to be around them. It is not in number, it is by contact. When the contact becomes more than what is normal, the cells will stop multiplying. So when it reaches the limit of contact, it will stop multiplying. This is the ability that every cell has. Some cells might lose this ability. Then what? It doesn't realize that there are more and more cells being formed, more cells being pushed. So what do? They keep multiplying. Cells which lose contact inhibition keep multiplying. Let's say if this particular space can accommodate 100 cells. Let's say this space can accommodate 100 cells. Some cell has lost the ability to identify contact, so it has lost contact inhibition. Now this starts multiplying, and it is making about 25 cells of its kind. About 25 cells of its kind. A cell which is multiplying is not functional. If it is a liver cell, it is not performing the functions of the liver cell, it is multiplying. While multiplying, the cell does not perform functions. The cell has to be in the G0 phase. G0 phase is the functional phase. Interphase is G1 to G1, G2, G1, yes, G2. That is the interphase. So when it gets into G1 phase, it is getting into the interphase. It is getting into multiplication phase. It has to be in G0 phase to function. But these are all in multiplication phase. So they don't function. What happens? 75 cells are performing function. 25 cells are occupying space but no function. So what happens to the function of this organ? The functioning of this organ has come down by 25%. The function of this organ has come down by 25%. That means if a particular organ is not doing 25% of its role, consequences proportionate to that happen. Correct? They will not stop multiplying. So what does it do? It continues to multiply. It becomes 50%. Now the organ becomes 50% functional. 50% of its function is lost. Then gradually it will completely cover the entire organ. So the organ becomes completely useless. What liver is supposed to do, if the liver is not doing because of this cancer, then there is no toxin. Then there is no detoxification of the body, metabolic cleansing is not happening, there will be accumulation of toxins in the body. That will lead to secondary effects. Cancer is not doing anything directly, it is just multiplying. It is making the system dysfunctional, non-functional. Alright? That's all. Now, every organ is having blood supply. When these cells are multiplying and they come in contact with the blood vessel, they multiply and the blood vessel also can get eroded. So some of these cells get into the blood vessel. When they get into the blood vessel, what will happen to these cells? When they get into the blood vessel, what will happen to these cells? They get into circulation. Wherever they get stuck, they are going in circulation. As long as the vessels are bigger than the cell, it keeps flowing. But wherever the cell gets stuck, maybe in some capillary of some other organ, it started with liver, let us say, it goes and gets stuck in the alveolar capillary, in the lungs. So there it will stay. What will it do there? What will it do in the lungs? Same thing. Multiply. That part of the lungs is gone. It can spread to other parts also. See, a cell which is supposed to do its work just goes on increasing its number, but it does not do any work, is cancerous to the body. It is damaging to the body. Somebody who is supposed to perform some duty, not performing that duty but constantly engaged in self growth. You are in a government office, you are not doing your duty of carrying out the duties that you are supposed to do, but you are constantly looking for opportunities to build your own wealth. You can consider this, it's like building its own wealth, building its own kind of wealth. That is cancer. Alright. You are not only HIV, you will also be cancerous HIV if you are correct. Alright. So this is all, that's all, cancer is that's all. Problem because of cancer is wherever it goes, it will damage. It is not causing damage. The cancer cells can say, what am I doing? I am not doing anything to you. I am just multiplying. Have I told you not to perform your duty? I am not telling you not to do your duty. I am just multiplying. I am just taking care of my own needs. How do I ensure my children are happy? I am just making wealth for my children. I am not actively doing it. It is just happening. People tell, no, I don't ask for bribes. They give it. I can't deny. Cancer is one of the most dreaded diseases of human beings and is a major cause of death all over the globe. More than 1 million Indians suffer from cancer and a large number of them die from it annually. And there is one more characteristic of cancer cells. See, initially you know when you study the initial cancer cells, you know it is a liver cell, if it is a liver cancer. But as it keeps on multiplying, it will lose its identity. It will lose its identity. The only identity is that it keeps on multiplying. That's all. You will not be able to make out where did it come from. Because the cell has lost its specific characteristics. It loses its characteristics. Alright? Where it begins is called the primary, where it spreads to. So in this case, liver is the primary cancer. What comes into the lungs is the secondary cancer. The process of spread is called metastasis. Metastasis, movement from one place to another place. Moving and positioning itself in some other place. Metastasis. So remember, primary tumor, tumor is a reference to cancer. Tumor is a reference to any abnormal mass. A tumor which is aggressive and actively multiplying and spreads to other places is called a malignant tumor. That which does not spread is a benign tumor. Okay, as long as the tumor has a boundary, it is isolated, it has a boundary, it has not spread too much, you can remove it off. How do you deal with it? Wherever you find tumor, you have to remove it. Stages, let us say. There are two things that will be spoken about when we talk about cancer. Grade and stage. Grade and stage. Grade of a tumor is the characteristics of the tumor. Stage of the tumor is a reference to spread. How much it might have spread. A higher grade, lower stage tumor is still fine. Higher grade and higher stage tumor, prognosis is bad. Prognosis means the chances of survival or the chances of recovery. That is prognosis. Alright. So, if the boundary is clear, you know the boundary of the tumor, what do? You cut it off. You operate, you cut off the tumor along with the surrounding normal tissue. So that you are hoping that the entire tumor mass is removed. Then, next stage, you will not leave it at that. You will, by irradiation, by high intensity radiation, you will treat that particular place and the surrounding tissue. So you are cut off surgically, and then by radiation therapy you are killing the cells in the surroundings. Some normal cells also will die, it's okay. Your hope is that all the cancer cells have been eliminated. Boundary is not clear. Boundary is not clear. So you are not sure that the tumor has spread or not. There is a particular diagnostic method. What is the diagnostic method to find out metastasis and secondaries? Are you aware? There are multiple imaging techniques. Number one, ultrasound. Ultrasound is used to study fluid intervention tissues. Wherever there is fluid and the tissue interface, you can study by ultrasound. Soft tissues you can study by ultrasound. Then you have X-rays for studying hard tissues, bones. Wherever you want to study bones alone, you can use. Then you have X-ray based CT. CT is also X-ray only. It uses X-ray. It is a different imaging technique. It is like it will take slices of images. X-ray will just, it's like this. Wherever you position the tissue and pass X-rays, it will give you an image based on what tissue is blocking the X-ray to what extent. CT gives you slices. It's like you take a slice here and you get an image at that level. So 64 slices it will take of the tissue that you want to study. So level by level you can study in CT. Then you use magnetic resonance for imaging, that is MRI. Another higher level of imaging that you use to study secondaries or tumors in the body is tumors, and there are various other applications of that. You use nuclear medicine, positron emission test, PET. It's called PET scan, positron emission test. You use a radioactive nucleotide injections to make it circulate in the body, and you take images. There are different kind of radionucleotides that you use to find out different kind of tissues. Very conclusive or very high accuracy test to identify secondaries. An entire body positron emission test scan can tell you if there are tumors in any other part of the body, in any part of the body. So you don't see boundary, tumor might have spread, you have to remove the mass anyways, do radiation, plus you will do chemotherapy. What is chemotherapy? Drugs are put through the blood vessels. You inject chemicals, you inject cancer specific drugs. They are all drugs which are designed to identify certain markers on the tumor cells. Certain markers on the tumor cells. And they will go and specifically attack those cells which have those markers, abnormal markers on the tumor cells. But the problem with chemotherapy is, some of the normal cells also might have those markers. So, though the cancer cells also might get eliminated, normal cells also will get affected and die. Very commonly affected markers which are similar to the tumor markers are hair follicle roots, the roots of the hair follicles. So when the person is undergoing chemotherapy, those chemotherapy drugs will attack the cancer cells also, but it also attacks the hair follicles. Therefore, you find many people with chemotherapy experiencing massive hair loss. Hair loss is seen. Anyways, the treatment modes are improving, and there are multiple types of treatments being available now. The ability to treat cancers and cure cancers has become better. But unfortunately, the incidence of cancers are also increasing. Now we find more and more people developing cancers. Look at the cause of it. What is the cause? The cells lose the ability to identify contact inhibition. That's all. The cell becomes abnormal. What can trigger it? It can be radiation, it can be temperature, it can be chemicals which constantly irritate the cells. Constant irritation of the cells can lead to transformation of the cells into cancerous cells. Now look at it. We are constantly surrounded by radiation. All around, throughout we are exposed to radiation. Every mobile phone is operated by radiations only. Lot of radiation in the surroundings. So, we are constantly exposed to that. Second, we are constantly exposed to pesticides and other such chemicals which are loaded into our foods. Washing will not take away the pesticide. Those residues are in the cells of these plants and fruits and vegetables which have been treated with that. So we can't remove that. Water treated with chemicals. Air has a lot of toxins. The air we breathe, the water we drink, the food we eat, the light around us, everything is potentially a carcinogen, potentially cancer stimulating influence. So if we are not developing cancer, we should be grateful. Everybody is at a risk of developing cancer. So much for human development. Okay. So is development good or bad? Depends on what you are looking at. On the quality of life, development has definitely reduced the quality of life as such, but certainly increased the lifestyle. So what is your focus? You want a better life or a better lifestyle? That's a personal choice. Alright? So better life is the lifestyle, is the best option. You chase lifestyle, there is no end to it. You want to acquire more and more. You earn a lot of money and invest on a better life, better quality of life, that's a good way to go. Okay, we will read it now. Cancer is one of the most dreaded diseases of human beings and is a major cause of death all over the globe. More than 1 million Indians suffer from cancer and a large number of them die from it annually. The mechanisms that underlie development of cancer or oncogenic transformation of cells, its treatment and control have been some of the most intense areas of research in biology and medicine. See, in response to the exposure to all of these influences which can make us develop cancer, is the production of free radicals in our body. Free radicals, oxygen free radicals and various other free radicals will be produced in the body, which are the ones which go and attack the cells at various levels and trigger the development of cancers. Got it? Yoga, pranayama, meditation, all of these are proven to reduce the free radical levels in the body. Reduce the stress, tackles the free radicals in the body. Breath you have to use very effectively. You have to use your body, breath and mind in coordination to deal with all these influences. So that is a part of a better lifestyle. Including yoga, pranayama and meditation as a part of your daily routine will help you deal with the free radicals and manage your internal health better. In our body, cell growth and differentiation is highly controlled and regulated. In cancer cells, there is breakdown of these regulatory mechanisms. Normal cells show a property called contact inhibition, by virtue of which contact with other cells inhibit their uncontrolled growth. Cancer cells appears to have lost this property. Contact inhibition is like responding to the people around you. You are thinking about their welfare also. When you lose that ability to respond to the people around you, you are cancer. Okay. Cancer cells appear to have lost this. As a result of this, cancerous cells just continue to divide, giving rise to masses of cells called tumors. Tumors are of two types. Benign and malignant. Benign tumors normally remain confined to their original location and do not spread to other parts of the body and cause little damage. Malignant tumors, on the other hand, are a mass of proliferating cells called neoplastic or tumor cells. These cells grow very rapidly, invading and damaging the surrounding normal tissues. As these cells actively divide and grow, they also starve the normal cells by competing for vital nutrients. Cells sloughed from such tumors reach distant sites through blood, and wherever they get lodged in the body, they start a new tumor there. This property is called metastasis. It is the most feared property of malignant tumors. Causes of cancer. Transformation of normal cells into cancerous neoplastic cells may be induced by physical, chemical or biological agents. We have discussed all of this, now we just have to read. These agents are called carcinogens. Ionizing radiations like X-rays and gamma rays and non-ionizing radiations like UV rays cause DNA damage leading to neoplastic transformation. UV, A, B, C are the three types of UV rays that we study. Which one is the most damaging? Of A, B, C, which UV rays are most damaging? Which one has higher frequency of A, B, C? Higher frequency is damaging or higher wavelength is damaging? Higher frequency radiations are damaging. High frequency radiations are damaging. So in A, B, C, which one is high frequency? Which one is of higher frequency? You use body lotion, sunscreen, all that, no? What is written on that? About UV protection. What is written? Not studied. You should read the labels of the products that you use. Anybody has any of those with you? Everybody is looking at one person. UV A and B protection would be written. UVC, ultraviolet C does not reach the surface of the earth. 100% of ultraviolet A reaches the earth, reaches our atmosphere. 50% of ultraviolet B reaches our atmosphere. Ultraviolet C does not reach our atmosphere. Ozone layer blocks ultraviolet C completely. Ultraviolet C completely. Ozone layer blocks 50% of ultraviolet B. Ozone layer cannot stop ultraviolet A because ultraviolet A is closer to the visible spectrum only. Alright. C is most damaging. So damage to ozone layer can increase the penetration of ultraviolet C into the atmosphere. That is why your sunscreens do not have ultraviolet C protection. Ultraviolet A and B protection. Alright. Anyways. Now, it's called cellular oncogenes. or proto-oncogenes have been identified in normal cells, which when activated under certain conditions could lead to oncogenic transformation of the cells. Cancer detection and diagnosis. Early detection of cancers is essential as it allows the disease to be treated successfully in many cases. Cancer detection is based on biopsy and histopathological studies of the tissue and blood and bone marrow tests for increased cell counts in the case of leukemias. Leukemia is blood cancer. In biopsy, what is biopsy? You take a slice of the tissue and study for the nature of cells. In biopsy, a piece of the suspected tissue cut into thin sections is stained and examined under microscope by a pathologist. Techniques like radiography, use of X-rays, CT, computed tomography and MRI, magnetic resonance imaging are very useful to detect cancers of the internal organs. CT uses X-rays to generate a three-dimensional image of the internals of an object. MRI uses strong magnetic fields and non-ionizing radiations to accurately detect pathological and physiological changes in the living tissue. A pregnant woman should not undergo what tests?
X-rays.
A pregnant woman should not undergo X-ray. Then anything else? Can she undergo ultrasound scanning? Can a pregnant woman undergo ultrasound scans? She can, done frequently, regularly. Can a pregnant woman undergo CT? CT, computed tomography. Why not? That is also based on X-rays. One CT is equivalent to 300 X-ray exposure. Okay, CT definitely no. When you get exposed to X-rays, whatever is the amount of exposure you get, one CT is equivalent to 300 times that exposure. Very high exposure. Can a pregnant woman undergo MRI? MRI can be done. Pregnant women can get MRI. It is not using X-rays, it is using non-ionizing radiations. It is using magnetic resonance for imaging. Okay. What do you call these things? Let's say if X-ray is done on a pregnant woman, what will happen? What can happen? It can cause abnormality in the baby. So what is X-ray for the baby now? What do you call those influences which can cause abnormality in the baby as? No, not carcinogens. Carcinogens are cancer developing ones. X-ray will not cause cancer in the baby, it will cause some developmental abnormality. It can be some drugs, medicines, X-rays, some other radiation, some other exposure, infections. All of these can cause developmental abnormalities in the baby. What are these influences which cause developmental abnormalities called? Carcinogens cause cancer. Dash causes developmental abnormalities in infants, in fetuses. Teratogens, they are called teratogens. T-E-R-A, teratogens. Teratogens are the ones which will cause abnormalities in the developing fetus. So drugs have teratogenic effect. X-rays has teratogenic effect on the developing fetus. So teratogen you have to remember. When as you are looking at carcinogen, remember teratogen also. Antibodies against cancer-specific antigens are also used for detection of certain cancers. Techniques of molecular biology can be applied to detect genes in individuals with inherited susceptibility to certain cancers. Cancer can be considered as a combined effect of susceptibility and exposure. If a person is highly susceptible to cancer genetically, a small exposure can lead to cancer. Let us say susceptibility into exposure is the factor that influences. Assume 100 units should be the total count for a person to develop cancer. Susceptibility into exposure is influence or the manifestation. Let us say this has to be 100 units. When 100 units happen, when there is 100 units totally, the person will develop cancer. Let us assume that. Person A has 20 units of exposure. Let us say exposure is smoking cigarettes. Person A smokes 20 cigarettes a day. His susceptibility should, let's say if his susceptibility is 1, will he develop cancer? He will not develop cancer. Genetically he is protected. Very low susceptibility. He is smoking 20 cigarettes a day for his lifetime. Nothing is happening. Somebody's susceptibility is 25. Exposure equivalent to 4 cigarettes will lead to cancer. And this person might be a non-smoker. If you are living in a metropolitan city, even if you are a non-smoker, your exposure will be equivalent to so much. So a non-smoker develops lung cancer. How do you explain it? Even the passive exposure triggered development of cancer in him because of high susceptibility. Of these two, susceptibility and exposure, which one can you measure? Which one can you measure? Can you measure susceptibility?
No.
There is no way to find out what is your susceptibility to a particular disease, which has a genetic influence, like diabetes or hypertension or cardiovascular diseases. What is your susceptibility cannot be measured. But you know what are the risk factors, what are the factors exposed to which can increase your risk of developing that particular disease. Exposure can be known. Avoid getting exposed to all known causes of cancer or any other disease. You know the causes of something, these things can cause something. Avoid exposure. If your susceptibility is very high, you are postponing the manifestation of disease. If your susceptibility is very low, excellent. Better to avoid the exposure. Deal with exposure. You don't know what your susceptibility is. Right? Treatment of cancer. Common approaches for treatment of cancer are surgery, radiation therapy and immunotherapy. In radiation, tumor cells are irradiated lethally, taking proper care of the normal tissue surrounding the tumor mass. Several chemotherapeutic drugs are used to kill cancerous cells. Some of these are specific for particular tumors. Majority of drugs have side effects like hair loss, anemia, etc. Why? I told you. Why will hair loss and anemia such things happen? Because the markers which are identified by the chemotherapy drugs can also be present on the normal cells. So any cell with those markers will be attacked by the chemotherapy cells. These cells are also affected, leading to hair loss or anemia and such. Terrible. See, people undergoing chemotherapy will have a lot of nausea. There will be gastric irritation that happens. Weakness, tiredness, muscles are also affected in a way. Loss of appetite. So people undergoing chemotherapy generally go through a period of weight loss. They become weak. But once the chemotherapy is successfully completed, they will get back also. A lot of nutritional supplementation is done. Therapeutic supplementation is done. It's not a easy journey to overcome cancer, but unfortunately, that is what we have at this point of time to deal with it. Looking at from another perspective is, fortunately, we have something to deal with it. May not be the most effective, but we have effective ways of dealing with it. Though uncomfortable, we can still deal with it. Tumor cells have been shown to avoid detection and destruction by immune system. Therefore, the patients are given substances called biological response modifiers such as alpha interferon, which activates their immune system and helps in destroying the tumor. Drugs and alcohol abuse. Okay. We'll do it now and then take a break. We still have 20 minutes for the halfway. What do you call as a drug? What is a drug? What is a drug? Any chemical that enters your body which can modify your physiology is a drug. Simple. Simple language, any chemical that gets into your body that can modify your physiology is a drug. Some things can modify it in a positive way, some things can modify it in a negative way. Most of the drugs have both. It has positive influence for something and negative influence for some other thing. What you are using as a positive influence for the drug is its effect. What nevertheless happens, but you don't want that to happen, are side effects. Okay. So what good you expect that the drug will cause is the effect of the drug. What harm it causes, even though you don't want it, are the side effects of the drug. So various chemicals have various types of influences on the brain. There are drugs called psychoactive drugs and psychotropic drugs. Psychoactive drugs will alter the extent of reality perception, alter the extent of reality. Extent of reality meaning the psychoactive drugs can make your brain get suppressed. The or brain gets excited. We are talking about psychedelics. Psychedelic drugs are the drugs which will influence the brain responses. That is what we are talking about here as drugs. Drugs in a broader sense can be medicines also. Your paracetamol is a drug. It acts on the hypothalamic temperature regulation center and reduces your body temperature. It will bring down body temperature. You have analgesics which will act on the pain receptors and bring down your pain response, pain influence. You have bronchodilators which will cause dilatation of the bronchi and makes your breathing more comfortable. You have steroids which will act on something else. But here what we are talking about drugs are the drugs which will influence the nervous system. Nervous system influencing drugs we are talking about. There are psychoactive drugs and psychotropic drugs. Psychotropic or psychedelic drugs. So, stimulation or suppression of the brain function is one category of drugs. Another category of drugs is altering perception, altered perceptions. Alright? Altering perceptions. They can be hallucinogens, delusional drugs, drugs which will cause delusions, drugs which will cause hallucinations. What is delusion and hallucination? What is a delusion and what is a hallucination? Many people are delusional. Many people are delusional, or even in fact, most people are delusional. But we cannot call them abnormal. Okay? What is delusion? Delusion, illusion, hallucination. Three states of not so normal mental function. What is an illusion? Magic illusion. It creates illusions are, you can say, we call it Brahme. That is, you are thinking about something in a way that it is not existing, in a particular way that it doesn't exist. So you are having a wrongful idea of something. I have an illusion that tomorrow there will be a volcanic eruption. I have an illusion. I don't see it, but I am feeling about it. It's a feeling. Illusion is a feeling. Delusion, faulty perceptions. Delusions are faulty perceptions far from reality. There is a strand attached to reality also, but faulty perceptions. Like delusion of persecution, delusion of grandeur, Two types of delusions are there. Delusion of persecution and delusion of grandeur. Delusion of reference. Three delusions that you find commonly. Delusion of reference is two people are talking. You think they are talking about you. They may not actually be talking about you. They are talking is the reality. They are talking is reality. You look at it and you twist it. Twisted reality is delusion. You assume that they are talking about you. That is delusion of reference. Delusion of persecution. Delusion of persecution. Somebody is trying to harm me. I have a delusion that you want to kill me. I have a delusion that you want to kill me. So I will try to find the logic to justify that. Okay? I have a feeling that he wants to kill me. Now he is wearing a red colored jacket. Now I will think, or she is wearing more red. Okay. Okay. I will start thinking that look, today she is definitely going to kill me because as a mark of statement, she is wearing a red sweater. I have to be careful. I have to somehow get out of this room and I'll run away. Slowly, I'll just try to escape. Delusion. On a non-pathological sense, people are delusional about their abilities. People are delusional about their problems also. People, it's wrong, it is faulty perception of your situation. So your problems are of a particular magnitude and you are delusional about the problem being too great to handle. They are too big, you are delusional about it. You think that the problem is impossible to tackle. Everybody is trying to complicate things for you. The world is not allowing you to progress. My family is not supporting me. They are actively trying to stop me. These are all delusions. You find it in common people also. External locus of control. They feel the world is trying to stop them, not taking charge of it. Hallucinations are seeing what does not exist. Seeing or hearing what does not exist. There is no reality to support it. I hear people speaking, hallucination. There is nobody speaking, but you hear sounds, hallucination, auditory hallucinations. Okay? Schizophrenia is characterized with auditory hallucinations. Schizophrenia is a disease, is a disorder of the brain. People start hearing sounds. People start hearing their ancestors speaking to them. Hallucinations. You might have seen, some people will go into a state of trance and they will start telling you that God is talking to me, I can hear, God is telling this and that and this and that, your ancestors are telling this. So many things they tell. They can be explained as hallucinations scientifically. Beyond that, there might be some extrasensory perception. I don't know, but those extrasensory perceptions are called hallucinations in psychological terms. Okay? Okay. So these drugs that we talk about can take people into these kind of states. We will see what each one does. Surveys and statistics show that the use of drugs and alcohol has been on the rise, especially among the youth. This is really a cause of concern as it could result in many harmful effects. Proper education and guidance would enable youth to safeguard themselves against these dangerous behavioral patterns and follow healthy lifestyles. There is a lot of marijuana available freely. Variety of drugs available freely in the open market. One of the greatest dangers in our country is the ease of availability of drugs. Prescription drugs, some of the prescription drugs are being misused. Okay, I'm not going into too many details, but you have to say absolutely no to any kind of drug abuse. It starts with people telling that it gives a different kind of an experience. Try once, anyways, nobody is getting addicted to it. But brain always wants to revisit or re-experience the highs. Whatever gives you a high, brain wants to re-experience it. It will create force on you to re-experience that. Sugar high is the biggest high that people experience. Sugar, salt and oil. Sugar, salt and fat. These three in combination is destroying the health of the world. All your snacks loaded with salt and fat. all your chips, whatever snacks you eat, savories, loaded with salt and fat, along with a little bit of sugar also. All the sweets, chocolates, confectionery business, loaded with sugar. Brain gets a kick out of that, and the brain wants it again and again and again and again. Drugs are also like that. These abusive drugs are also like that. Once the brain experiences that high, you crave for it. You may not have got addicted. The next time the brain will say, another, we'll do it every now and then whenever we are having a party. We'll just smoke weed. That's how it begins. Gradually, the brain will not listen to you. Every time you push the brain to an abnormal perception, abnormal sensation, the brain is becoming weak. Your willpower is weakening, and there will be a time when the scale tilts, and you are no longer able to control the drive that your brain is pushing you into. Okay? How much ever you think you are strong, even one instance of drug abuse can begin the process of you getting into it completely over a period of time. Stop. Be strong and don't do it at all. Zero exposure. Including alcohol. People say alcohol, social drinking, I will have only once in a while just to have fun when friends get together. No. Keep it zero. No exposure at all. Okay? I have never had alcohol in my life. I don't know how it tastes. I don't smoke, I don't do drugs, no alcohol. I'm a vegetarian. So many of my friends ask me, what other reasons do you have to live? I will live till my clock ticks. I have other things to do. Drugs which are commonly abused are opioids, cannabinoids, and coca-alkaloids. Majority of these are obtained from flowering plants, some are obtained from fungi. Opioids are the drugs which bind to specific opioid receptors present in our central nervous system and gastrointestinal tract. Heroin, commonly called smack. See, whatever is given as examples, their colloquial names, all of this you have to remember. Heroin is called smack, is chemically diacetyl morphine, which is a white, odorless, bitter crystalline compound. This is obtained by acetylation of morphine, which is extracted from the latex of poppy plant, Papaver somniferum, generally taken by snorting and injection. Heroin is a depressant and slows down body function. See, morphine is a medically used drug also. Morphine is a medically used drug also, very powerful analgesic. People with terminally ill diseases, experiencing terrible pain, you cannot save them. People with terminal cancers, terrible illnesses causing extreme pain. Morphine is given as a drug. Medically it is given to reduce that pain. They will anyways die. They should not experience that intense pain till they die. Morphine is given. Absolutely fine. It has a very powerful pain reducing effect. But what people use it for? When morphine is taken, abused. When heroin is taken, it slows down the body, it slows down the metabolism, it reduces pain, opioid receptors are activated, it is blocked. Everybody has some or the other pain, some discomfort in the body. When that discomfort is relieved, the person feels very light and very peaceful, calm. Alright? Cannabinoids are a group of chemicals which interact with cannabinoid receptors present principally in the brain. Natural cannabinoids are obtained from the inflorescence of the plant Cannabis sativa. The flower tops, leaves and the resin of cannabis plant are used in various combinations to produce marijuana, hashish, charas and ganja. Generally taken by inhalation and oral ingestion, these are known for the effects on the cardiovascular system of the body. Marijuana. Coca-alkaloids or cocaine is obtained from coca plant, Erythroxylum coca, native to South America. It interferes with the transport of the neurotransmitter dopamine. Cocaine, commonly called coke or crack, is usually snorted. You see that now? You put some powder on the the wrist and they'll snort it. It has a potent stimulating action on central nervous system, producing a sense of euphoria and increased energy. Dopamine is a calming hormone. Dopamine receptors are blocked, the person becomes more energetic, feels more powerful. Excessive dosage of cocaine causes hallucinations. Other well-known plants with hallucinogenic properties are Atropa belladonna and Datura. Datura seeds are used for hallucination. These days, cannabinoids are also being abused by some sports persons. Why? Why do you think sports persons will abuse cannabinoids?
Increased energy.
Clarity. See, marijuana, hashish, charas, ganja, all of these will give a sense of better clarity. The person starts feeling that he is more clear in thinking. Reduces inhibitions. Makes the person more focused. Do you all want it for exam preparation? All right. Don't take it. One drug which is abused by medical students is amphetamines. Amphetamines are reticular activating system stimulants. Reticular activating system is responsible in your brain. Reticular activating system is responsible for alertness and wakefulness. So to study throughout the night, pop amphetamine. Amphetamine tablets are available in pharmacies. Medical students, they cannot get it. Take amphetamines and stay throughout the night. It will keep you awake, but you will not have focus. Concentration will not be there. You will not be able to fall asleep, but you will not be able to concentrate also. It's like operation successful, patient dead. Okay. You are awake, but you are not able to study. What's the point? Better sleep. Drugs like barbiturates, amphetamines, benzodiazepines and other similar drugs that are normally used as medicines to help patients cope with mental illnesses like depression, insomnia are often abused. Morphine is a very effective sedative and painkiller and is very useful in patients who have undergone surgery. Several plants, fruits and seeds having hallucinogenic properties have been used for hundreds of years in folk medicine, religious ceremonies and rituals all over the globe. When these are taken for a purpose other than medicinal use or in amounts or frequency that impairs one's physical, physiological or psychological functions, it constitutes drug abuse. Smoking also paves the way to hard drugs. Tobacco has been used by human beings for more than 400 years. It is smoked, chewed or used as a snuff. You have seen people doing all three? Smoking, goats do that, constantly chewing. Here I have seen a large number of people constantly doing that. Betel nut and why? In one of the visits, I forgot to bring toothbrush. Okay, I went to that shop there and bought a toothbrush. It was mentioned Gutka red toothbrush, hard bristles. I tried to brush with that. My 2 strokes of the toothbrush, my gums got separated from the teeth. It is so hard. Then I took it home. I bought one more new one for that, and I took it for cleaning some. You have tap and around the tap on the sink. The normal sink cleaning brush doesn't go. I'm using that for cleaning the sink. I cannot clean this sink with that. Horrible. Then I got the one just outside of this gate. There we get Colgate zigzag toothbrush. Every chemical that is present in the body will be present at a particular baseline. So there are receptors to pick up what is the baseline. Now, certain things are not supposed to be in the body. So the normal baseline is not having those chemicals in the body. Let us consider tobacco. What is the active component of tobacco for which people smoke? nicotine. Body is designed to function optimally at zero level of nicotine. Nicotine should be zero level. You start smoking. When you nicotine has its effect. It causes a kind of positive feeling, pleasant feeling, feeling light, more clarity of mind, and all those effects are of nicotine. It influences the nervous system and brings about those effects. Body is not exposed to nicotine at all. Let us say that is where we are beginning. Now, when you smoke your first cigarette, the nicotine that enters into your blood, let's say it reaches to 10 units of nicotine in the blood. 10 units of nicotine will give you a certain sense of high. Whatever is the high that people want from cigarette, it gives them that. So the brain gets kind of active. You like that feeling. You like the feeling of, that nicotine gives you in your brain. So you start smoking one cigarette every day. One cigarette gives you how many units of nicotine here in our example? 10 units of nicotine. With 10 units of nicotine being constantly present in blood, your body will reset the baseline for nicotine. What used to be 0 now will be 10 units of nicotine. That means with 10 units of nicotine, it will be as good as not having nicotine. Body learns to not get affected by 10 units of nicotine. So now to get the same feeling, what should you do? You should add another 10 units of nicotine. So total nicotine consumption should become now 20 units. That means one cigarette is not giving you the kick. You will start smoking 2 cigarettes. But the kick you are getting is the same as what you got with one cigarette when you started. You understand? Baseline was 0. 10 units gave you a particular experience. Now baseline has become 10 units. So 10 units is the new 0. 20 units will give you the same experience as you got with the initial 10 units. What will happen? You keep continuing to smoke 2 cigarettes. What will happen to your baseline? Shifted up. 20 unit becomes the new baseline. You will no longer get the kick with 2 cigarettes. To get the same kick, you need to add one more cigarette, 30 units. Within a few days, 2 weeks, 30 unit becomes the new baseline. Keeps on pushing. So even somebody who is smoking 20 cigarettes a day, he is still experiencing the same kick that he experienced with one cigarette when he was a non-smoker. That's all. Every smoker is trying to get the kick of one cigarette being smoked when he was a non-smoker. That's all. That's how addiction happens. De-addiction. How do you go about de-addicting the person? If you do emotional drama, we see, I do a lot of de-addiction. I give a lot of de-addiction guidance to people. I treat people for addictions. What family members do is they create a lot of drama. They humiliate the addicts. They say you are bad, you are this and that, because of you so many problems are happening. Children will come into the picture, they will start playing all this, and they will feel guilty. They are made to feel guilty. Now in the guilt they stop. Suddenly they will say, from tomorrow I will not smoke, and they will throw out the packets, the pack of cigarette and all that, and from the next day they don't want to smoke. They can't, because the body is used to having that level of nicotine, and suddenly you stop, they will start developing withdrawal symptoms. Withdrawal symptoms are physical discomfort, actual discomfort. They will not be able to remain normal. They will start developing restlessness, muscle cramps, breathlessness. All of this will happen. So there will be rebound addiction. They will again get back to it. When they get back to it, family again creates drama. So you go into that guilt and conflict cycles. You humiliate them, you criticize them. All of that will push them into further emotionally down state, which can be overcome by smoking more. Alright? So de-addiction can happen with a supportive, encouraging, motivating, pleasant environment. You have to create a pleasant and supportive environment They will fail. The addicts will fail in their attempts multiple times, but you have to be patient. Two principles that I have used very successfully and which will help de-addiction from smoking. Smoking de-addiction is very achievable. Even if somebody is smoking 3 packets of cigarettes a day, 30 cigarettes a day, they can still get to 0 cigarettes a day by these two principles. Number one, delay. Every time you get the urge to smoke, delay by 10 minutes. That's all that they can do, they will agree. Second, ration. Ration your stock. You are smoking 20 cigarettes a day. From today, you have to keep a stock of 19 cigarettes in your pocket. Keep 19 cigarettes in your pocket. You have to manage your entire day with 19 cigarettes. Don't smoke 20 cigarettes. You reduce 1 cigarette and sustain like that for 2 weeks. 2 weeks. Now what happens? 20 cigarettes used to be the baseline. Now you are bringing it down to 19 cigarettes. 19 cigarettes will be the baseline. They are still smoking. They are not getting the same high, but they are not going into withdrawal symptoms. 19 cigarettes is sustainable now. They are comfortable with 19 cigarettes. For another 15 days, bring it down to 18. So if somebody is smoking 20 cigarettes a day, it will take about 10 months for them to completely get de-addicted. 10 months. In a month, you are bringing down the number of cigarettes by 2. 1 cigarette every 15 days, you bring it down. That's all. They have to be willing to do this. Without them willing to do it, it will not happen. By this program, what will happen is, see, you motivate them, you convince them, you encourage them to get out of the habit. This is a process to get out of the habit. If they are not willing to get out of it, or they don't see the rationale of getting out of it, it will not work. They will again go and smoke behind you. But this will help them manage the de-addiction cycle, de-addiction process. Rationing and delay. Ration by 1 less and delay. Okay, we will look at this one. So you should help people in your surroundings. If there are smokers in your family, in your relatives, amongst your relatives, in your friend circle, you should help them. And you should not get into it. Smoking also paves the way to hard drugs. See, smoking can be considered as the beginning of getting into hard drugs, or those brain altering drugs. Because they are used to some kick, and it is easy for smokers to get into hard drugs. Tobacco has been used by human beings for more than 400 years. It is smoked, chewed, or used as a snuff. Tobacco contains a large number of chemical substances, including nicotine and alkaloid. Nicotine stimulates adrenal gland to release adrenaline and noradrenaline into blood circulation, both of which raise blood pressure and increase heart rate. Smoking is associated with increased incidence of cancers of lung, urinary bladder and throat, bronchitis, emphysema, coronary heart disease, gastric ulcer, etc. The reason being, so many other chemicals in tobacco smoke have various effects. It is damaging to the blood vessels. It can cause damage to the inner lining of the blood vessels, that is the endothelium of the blood vessels, contributing to atherosclerosis, arteriosclerosis, which will trigger atherosclerosis. So coronary artery disease. Lung functioning gets affected. Bronchi are constantly irritated. Your smoke does not go up to the alveoli. Your smoke does not go up to the alveoli when you smoke. Bronchi and bronchioles is where it will reach the maximum. Bronchi are constantly exposed to smoke. So bronchi get inflamed, bronchitis happen, constant cough. All this are common. Emphysema is what? What is emphysema? Loss of elasticity in the alveoli. Loss of elasticity in the alveoli, and it bloats. So when the elasticity is lost, it will not be able to contract and relax normally. Tobacco chewing is associated with increased risk of cancer of the oral cavity. Smoking increases carbon monoxide content in blood and reduces the concentration of heme-bound oxygen. You know, carbon monoxide affinity to hemoglobin is 200 times more than that of oxygen's affinity to hemoglobin. So that hemoglobin which is bound by carbon monoxide is permanently unavailable for oxygen transport. Hemoglobin, to which carbon monoxide is bound, is not available for oxygen transport. That means you might have normal hemoglobin concentration, 14 grams, 15 grams per 100 ml, but you might still be experiencing symptoms of anemia because hemoglobin is not able to do its job of transporting oxygen. When one buys packets of cigarettes, one cannot miss the statutory warning that is present on the packing, which warns against smoking and says how it is injurious to health. Mukesh died reminding all of us that smoking causes cancer. You remember Mukesh? Man, Mukesh. No?
Yes.
Where do you find Mukesh? Movies,
Yes.
theaters. You go to theaters, before your protagonist of the movie comes, Mukesh comes. Mukesh is the hero of every movie. But people continue to smoke. They make fun of Mukesh only. Okay. Smokers make fun of Mukesh. Yet smoking is very prevalent in society, both among young and old. Knowing the dangers of smoking and chewing tobacco and its addictive nature, the youth and old need to avoid these habits. Any addict requires counseling and medical help to get rid of the habit. Very important. Support groups. Are you aware of a grouping called Alcoholics Anonymous? Alcoholics Anonymous is a social support group of alcoholics who are trying to get de-addicted from alcohol, who are trying to get out of the alcohol habit. It is a respectful group where alcoholics get together. They share their stories, why they got into alcohol addiction, how they got more and more addicted, what problems they faced from that, what are they doing to get out of it, what is working, what is not working. It is a group where people talk about it, not being judgmental about each other. See, it is very important to create groups where you can discuss what bothers you. A good group of friends are those who can freely and without hesitation discuss their problems, discuss what is bothering them, discuss their fears and limitations without being judged, or without that discussion being used against you somewhere else. If you have a few friends like that, then you have good support system. Ideally, family should become that kind of a support system where you are capable of, you don't hesitate to go and share anything. But unfortunately, that doesn't happen. You cannot go and share your limitations, your fears, your worries, your anxieties. You have to constantly work to become such a person with whom anybody can come and share anything. And never breach trust. Somebody comes and tells you about their personal things to you, that should never be discussed with anybody else, no matter what. If that becomes your code of honor, you will be a very respected and trusted person, and you can help a lot of people. Think about the time when you actually went and told somebody about your actual fears and anxieties and negative emotions. You don't do it. You have friends with whom you enjoy. You have friends with whom you just have entertainment. Those deep connections don't happen often. So the first thing that you have to do is you have to work on developing like such a person. You have to become that person who can be trusted. Then gradually you will find people around you. And you have to be careful. You should not go and tell anything and everything to everybody. More often it will be used against you. That is why you find a lot of social distress. Why are children committing suicide? 10-year-old, 20, 12-year-old children committing suicide. Why? There is something that is happening emotionally which they are not able to handle, and they don't find even one person that whom they can trust, with whom they can discuss. Alright. These are all signs of degradation of society. When a society degrades, when there are no channels of emotional conversations. Okay. Anyways, you all should, as responsible people, you should work on all of these things, not just work on making money. We have seen people who have made a lot of money, right, committing suicide. Recently, a very successful film director in Karnataka committed suicide. The worst part is, he committed suicide. That means he is not available on phone for anybody for 3-4 days. After about 4 days after his death, the neighbors in his apartment started smelling some bad smell, decomposing body, and they informed police. And when the police came, they noticed that this fellow has died. And when postmortem was done, it was about 4 days ago that he has died. That means for the last 4 days, nobody bothered to find out why he is not answering the call, why his phone is switched off. Is he alright or not? Look at the state of affairs. Alright. So success is not just about making money, success is building stronger human bonds. Alright. All of that, why I am telling that, why did I take 5 minutes to touch upon that, is because it is easy to blame the addicts. It is easy to criticize them for their addiction, but you are not helping them by criticizing them for their addiction. It requires counseling, it requires a support group, it requires emotional support, hand-holding, forgiving multiple times that they fail, being non-judgmental. All of this is required. Only then they will be able to come out. Otherwise they are weak. They have got into addiction because their mind has become weak. You further beat them up, there is no point. Adolescence and drug or alcohol abuse. Adolescence means both a period and a process during which a child becomes mature in terms of his or her attitudes and beliefs for effective participation in society. The period between 12 to 18 years of age may be thought of as adolescence period. In other words, adolescence is a bridge linking childhood and adulthood. Adolescence is accompanied by several biological and behavioral changes. Adolescence thus is a very vulnerable phase of mental and psychological development of an individual. Very important phase because suddenly the child starts realizing that there are expectations from the child. Till 12 years of age, that is still about 5 or 6 standard, 5th or 6th standard that you are in, there is not much expectations. But as you move into the adolescence phase, there are changes happening in the body also. There are physiological changes happening, and suddenly there are expectations. How you should speak, with whom you should speak, how you walk, how you talk. Everything starts getting linked to expectations. The child is not able to handle this. Alright? So, many people will find out ways to, they will find out their defense mechanisms to deal with it. They will start observing people, they will talk to some people, they will start noticing how others are managing, and they will manage. But it can be better handled. It can be better handled. We need to have systems which will create positive environments for natural development of individuals. We are not consciously creating those systems in our country. Unfortunately, the most failed institution in our country are schools. Schools have failed terribly. Our early education system has completely failed. It has not fulfilled anything, any responsibility of developing good individuals. It has just focused on creating labor force for the industry. Anyways, adolescence thus is a very vulnerable phase. Okay, curiosity, need for adventure and excitement, and experimentation constitute common causes which motivate youngsters towards drug and alcohol use. There are phases of development. You call that psychosocial developmental stages. Psychosocial developmental stages. This adolescent stage is the stage where in every stage of psychosocial development, there is a conflict. If the conflict is resolved, the individual comes out successful from that stage and ready for the next stage. If the conflict remains, it will affect the way the individual lives his life for his entire lifetime. The conflict in the adolescent stage is the conflict between dependence and autonomy. Dependence and autonomy. So an adolescent child wants to be independent. They want to make their own decisions. They want to be considered seriously. They want to make their opinions, give their opinions, and they expect their opinions to be respected. So they are attempting to establish their individuality. But the family and the surroundings are still treating them like children. That leads to conflict. You will fight. I know what to do, don't tell me. These things come there. All of you have gone through that, no? All of us have gone through those phases. So if you successfully come out of that stage, you will develop as confident individuals ready to take on the world, ready to take up responsibilities in the world. People who don't resolve the conflict of autonomy and individuality and arrive at a functional positioning psychosocially, they will not be able to make decisions. They will not be able to take up responsibilities. They will run away from accountability. So such are the people who will just wait in the background. There are so many things to be done. People who have resolved the conflict of the adolescent age will go and take up responsibilities. They are able to handle failures. They are able to handle criticism. But people who have not resolved the conflict there are afraid of criticism, they are afraid of failure, they are afraid of what others tell about them. They don't want to take up responsibilities, they just want to be safe. These are all unresolved conflict of the adolescent age. Systemically we can address all of this. But because all of that doesn't happen, these things will give an outlet for the adolescent children to tell themselves that they have grown up. Smoking makes them look like adults. Talking aggressively. Behaving in an abnormal way. Okay? Passing sexual remarks. Acting in inappropriate ways. All of these makes them feel like they are adults. Unresolved conflict. They need to be dealt with properly. A child's natural curiosity motivates him or her to experiment. This is complicated further by effects that might be perceived as benefits of alcohol or drug use. That is how it starts. Advantages are the ones which will be spoken in peer groups. Thus, the first use of drugs or alcohol may be out of curiosity or experimentation, but later the child starts using these to escape facing problems. I told you, running away from conflicts. Of late, stress from pressures to excel in exams or academics or examinations has played a significant role in persuading the youngsters to try alcohol and drugs. Emphasizing success in academics too much is one of the reasons for the failure of a lot of people. Exams are competitive. There are only a few people who will be able to cross. I always tell 25 lakh people write NEET. If all 25 lakh students are equally knowledgeable, are equally competent, it is still 1.25 lakh students who will get the medical seat. That's all. 23 lakh 75,000 people of the 25 lakh will not get a medical seat. That is the reality of competition. Now, getting a medical seat being the only objective of the process of preparation for 2 years will make all those who don't get the medical seat feel that they have failed. Problem. Okay? A lot of hospitals are built by people who are not doctors. To have a hospital and to be a doctor are not necessarily complementary skills. Right? You can build a hospital and make the best doctors work in your hospital still. That's still possible. You can be a great doctor but a pathetic manager. You may be totally uneducated, but you might be an excellent people manager. You will be able to build systems. So, putting things in perspective, giving everything its importance, but not making anything the most important thing of life is the key. Everything is important, everything is significant. Everybody in every vocation can become successful. So, diversifying the focus areas, normalizing the expectations, all of these are important to allow children to develop properly. And see, the risk here is getting addicted to alcohol, tobacco and drugs is real, happening extensively. It is happening extensively. We are seeing even school children getting into drugs. Big danger. The perception among youth that it is cool or progressive to smoke, use drugs or alcohol is is also in a way a major cause for youth to start these habits. Television, movies, newspapers, internet also help to promote this perception. Other factors that have been seen to be associated with drug and alcohol abuse among adolescents are unstable or unsupportive family structures and peer pressure. Alright. You should work on developing as individuals who can be self-sufficient, who can be a support for people who seek your support. If you have the family support, if you have a good friend circle, all of that is bonus. Not having good family support or not having a good friend circle should not be the reason or an excuse to get into bad habits. You can be that support. You develop yourself as the support system for others. You are not fortunate enough to have a supportive family or a supportive friend circle, but you can be that fortune for somebody. Don't be in that victim mindset. Crying about what you don't have, or crying about what others are not doing for you, or what others are doing to you, is victim mindset. You should not have the sense of victimhood. You should have the sense of ownership. I take charge. These small things can be trained from childhood. This is what should be training that should happen from childhood, not teaching from books. I tell my teachers, even without any of this, we can make daily newspaper as our curriculum, and still children can develop great amount of knowledge. So content is not the focus, competence should be the focus of learning. That is why, as you go through these 300 days of training, you will definitely benefit. You will definitely grow to become top class individuals and assets for the nation. Whether you become doctors or not, you will see. All of us are trying to get you into medical college. Excellent. But otherwise also, you will all be top class individuals. Because what you have learned in these years, what you are training yourselves on, it's massive power. Not even 1% of the population has this kind of power that they are working towards. Alright? Addiction and dependence. Because of the perceived benefits, drugs are frequently used repeatedly. The most important thing which one fails to realize is the inherent addictive nature of alcohol and drugs. There are two types of addiction: physiological addiction and psychological addiction. Physiological addiction is when there is actual withdrawal symptoms leading to physical distress. The person will experience terrible physical discomfort and pain when there is physiological addiction. Psychological addiction is you feel irritated, but you don't experience any physiological discomfort or abnormalities. Most of the drugs have both components. Physical as well as psychological dependence. Addiction is a psychological attachment to certain effects, such as euphoria and a temporary feeling of well-being associated with drugs and alcohol. These drive people to take them even when these are not needed, or even when their use becomes self-destructive. Okay? Addictive relationships are also like that. Even when somebody realizes that the relationship has become maybe a friendship or a relationship or anything, a social association has become toxic, there is harm in continuing to stay associated with that. People continue to stick on and to crib about, tag along to just somehow get back to what they experienced in the earlier stages. Not possible. With repeated use of drugs, the tolerance level of the receptors present in our body increases. That is what I told you. The baseline keeps increasing. Consequently, the receptors respond only to higher doses of drugs or alcohol, leading to greater intake and addiction. However, it should be clearly borne in mind that use of these drugs even once can be a forerunner to addiction. Okay, so experimentation, try it once, only once in a while, all of those are excuses to getting addicted. Thus, the addictive potential of drugs and alcohol into progress. In the absence of any guidance or counseling, the person gets addicted and becomes dependent on their use. Dependence is the tendency of the body to manifest a characteristic and unpleasant withdrawal syndrome if regular dose of drugs or alcohol is abruptly discontinued. This is characterized by anxiety, shakiness, nausea and sweating, which may be relieved when use is resumed again. In some cases, withdrawal symptoms can be severe and even life-threatening, and the person may need medical supervision. Have you come across advertisement which say de-addiction from alcohol without the knowledge of the alcoholic? Tablets for de-addicting from alcohol.
Yes.
You will find non-medical people giving those tablets. Those tablets are, I forgot the drug name. What those tablets do is, alcohol metabolism you should understand. Alcohol is broken down into aldehyde in the liver. Alcohol dehydrogenase breaks down alcohol to aldehyde. Aldehyde is broken down further to simpler and harmless metabolites which are excreted from the kidney. Aldehyde has a membrane destroying effect. Aldehyde can destroy cell membranes. Aldehyde is toxic. Okay? Alcohol, when alcohol is present in the blood, alcohol is what gives you the effect of alcohol. That sense of lightheadedness. All those effects are because of alcohol. The side effects, what people experience, some people vomit, some people have terrible headache. All of those are because of aldehyde. Alright? Aldehyde has tissue destroying effects. Now, if aldehydes are not metabolized properly in the body, it can lead to tissue destruction. So, when somebody consumes too much alcohol, they wake up with the hangover with headache and those body pain and all that. That is because of aldehyde being present in the blood for a longer duration before it gets metabolized, which leads to some damage of certain tissues, leading to all these hangover effects. Now, what these drugs do? The drug which is used for de-addiction from alcohol will block aldehyde dehydrogenase. If aldehyde dehydrogenase enzyme is inhibited, what will happen to aldehyde level? Aldehyde levels increases. So the person drinks alcohol, normally his aldehyde would have been metabolized. But now you have blocked the aldehyde dehydrogenase, aldehyde levels increases. So with the regular consumption of alcohol, he experiences headache, nausea, vomiting, retroorbital pain. One of the influence of aldehyde is it will affect the eyes, causing retroorbital pain. Too much aldehyde can cause blindness also. Too much aldehyde can cause death also. Now, under medical supervision, if the person is in a de-addiction center, he is allowed to consume alcohol with small doses of this drug being given as treatment. Now, when he is consuming alcohol, he starts experiencing these unpleasant symptoms. Unpleasant symptoms will condition the behavior. It is behavioral training. Now, over a period of time with treatment, the person will start developing unpleasantness, nausea and vomiting and discomfort by the sight and smell of alcohol also. Even if he wants to, he will not be able to drink it, because that will trigger that memory of unpleasantness. It's behavioral training. But what people do? Somebody gives the tablet. Wife is fed up with the husband's alcoholic behavior. She puts 2 tablets in food. He will not even realize the taste of it. He eats food and he drinks well. He can die also. Okay. So, handling that is very important. Dependence leads the patient to ignore all social norms in order to get sufficient funds to satisfy his or her needs. This results in many social adjustment problems. Not only social adjustment problems, crimes. Why criminals consume alcohol before committing the crime? Alcohol leads to loss of inhibition. Loss of inhibition, and the prefrontal cortex is inhibited. Prefrontal cortex is suppressed. Prefrontal cortex in your brain is the area of the brain which is associated with judgment. So prefrontal cortex will tell you the consequence of your action. It will constantly remind you of the consequence. The fear of consequence will make you stop doing certain criminal acts. But when you have consumed alcohol, prefrontal cortex is suppressed inhibition is removed, the person loses inhibition and the fear of consequence is gone. That encourages the person to commit crimes. Effects of drugs or alcohol abuse. The immediate adverse effects of drugs and alcohol abuse are manifested in the form of reckless behavior, vandalism and violence. All these are general things we will just read off. Wherever explanation is required, I will explain. Excessive doses of drugs may lead to coma and death due to respiratory failure, heart failure or cerebral hemorrhage. A combination of drugs or their intake along with alcohol generally results in overdosing and even deaths. The most common warning signs of drug and alcohol abuse among youth include drop in academic performance, unexplained absence from school or college, lack of interest in personal hygiene, withdrawal, isolation, depression, fatigue, aggressive and rebellious behavior, deteriorating relationships with family and friends, loss of interest in hobbies, change in sleeping and eating habits, fluctuations in weight, appetite, etc. These are all general things you can observe. There may even be some far-reaching implications of drug or alcohol abuse. If an abuser is unable to get money to buy drugs or alcohol, he or she may turn to stealing. Loss of inhibition. They just want it, that's all. Fear of consequence is gone. The adverse effects are just not restricted to the person who is using drugs or alcohol. At times, a drug or alcohol addict becomes the cause of mental and financial distress to his or her entire family and friends. Those who take drugs intravenously means direct injection into the vein using a needle and syringe, are much more likely to acquire serious infections like AIDS and hepatitis B. Because often drug abusers share the needles and syringes. Why HIV and AIDS? Loss of inhibition, altered mental states. They are more likely to indulge in reckless behavior. Reckless behavior exposes them to sexually transmitted diseases. The viruses which are responsible for these diseases are transferred from one person to another by sharing of infected needles and syringes. Both AIDS and hepatitis B infections are chronic infections and ultimately fatal. Both are fatal. Both can be transmitted through sexual contact or infected blood. The use of alcohol during adolescence may also have long-term effects. It could lead to heavy drinking in adulthood. The chronic use of drugs and alcohol damages nervous system and liver cirrhosis. Okay, liver cirrhosis is permanent damage of the liver tissue. I say, nature has its own way of ensuring its rules are being followed. In the human body, liver is the greatest representative of nature. No matter what you do, it will regenerate. It is only the alcoholics, with their great dedication, patience, perseverance and continuous effort, succeed in overcoming the force of nature and damage liver, cause cirrhosis of the liver. Okay. So whenever you look at alcoholics, you should prostrate before them. They are the masters of nature. They have won over nature. Nature tries to regenerate liver and they constantly try to damage it. They are the epitome of sacrifice. Alcoholics are the epitome of sacrifice. If you want to understand what is the manifested form of sacrifice, you should look at a chronic alcoholic. He sacrifices his income, sacrifices his job, friendship, relationships, wealth, social status, respect, everything. But commitment. Commitment to alcohol is what keeps them alive. Okay. So, the use of drugs and alcohol during pregnancy is also known to adversely affect the fetus. Alcohol is a teratogen. Alcohol can cause fetal developmental problems. Another misuse of drugs is what certain sportspersons do to enhance their performance. They misuse narcotic analgesics, anabolic steroids, diuretics and certain hormones in sports to increase muscle strength and bulk and to promote aggressiveness and as a result increase athletic performance. Okay. See, anabolic steroids are the ones which will promote muscle mass building. Anabolic steroids promotes the building of muscle mass. Okay. But anabolic steroids have other side effects. They can have suppressing effects on testosterone, so bulky muscles, but testosterone level can go down. It can lead to sterility, reproductive issues. The side effects of the use of anabolic steroids in females include masculinization, features like males, increased aggressiveness, mood swings, depression, abnormal menstrual cycles, excessive hair growth on the face and body, enlargement of clitoris, deepening of voice. In males, it includes acne, increased aggressiveness, mood swings, depression, reduction of size of the testicles. Why reduction of size of the testicles? See, anabolic steroids mimic testosterone. Now, it is the job of the testes to produce testosterone. Correct? You have a kitchen. A kitchen which is active is continuously producing food. All the kitchen staff are active, they are working. But if you continuously supply outside food to the house, family, what will happen to the kitchen?
Stop cooking.
The kitchen loses the ability to prepare food. That is what happens to endocrine glands. And endocrine, same with adrenal gland. Adrenal gland is supposed to produce steroids, corticosteroids, continuously in response to stress. But if you are continuously supplying steroids from outside, external steroids are being given to the body, there is no need for adrenal gland to produce steroids in response to any stress. Over a period of time, that particular gland loses the ability to produce steroids. Now this is kind of an example of which theory of evolution? Lamarck's theory of use and disuse. If that endocrine gland is not being used for the purpose of its function, it loses the ability to perform its function. These effects may be permanent with prolonged use. In the adolescent male or female, severe facial and body acne and premature closure of the growth centers of the long bones may result in stunted growth. Shortcut is often the longest route. Should remember that. Okay? There is always a right path for achieving anything. If you look for shortcuts and depend on shortcut, you are more likely to be taking the longer route. Alright? So stick on the right path. Tools and resources are there. You can use the tools and resources to accelerate your journey on the right path. If you deviate from the right path and take the shortcut, you are bound to fall. Alright? So anything that comes very fast by abnormal routes will lead you to fall down very fast. Right path is no choice. You have to take the right path only. Let it take time, no problem. Right. Prevention and control. The age-old adage of prevention is better than cure holds true here also. It is also true that habits such as smoking, taking drug or alcohol are more likely to be taken up at a young age, more during adolescence. Another biggest drive for adolescents to get into these addictions is the need to be in a peer group, the need for validation, acceptance. These kids who are abusing these things are more aggressive. They appear like the stars of the campus. You want to be a part of that group. To be a part of that group, you have to do everything that the group does. Otherwise, the group does not accept you. Get out of the group if there is a need, but don't do anything, don't do any harmful thing just to be a part of a group. How do you teach children all this? Very difficult. The parents of today's children are at a very great challenge. You will also be in a greater challenge because in the future, 10, 15 years down the line, you will be facing greater challenges because we don't know what the world will be like 10, 15 years later. With so much advancements happening in artificial intelligence, technology, machine learning, we just have to make ourselves strong to deal with it. Hence, it is best to identify the situations that may push an adolescent towards use of drugs or alcohol and to take remedial measures well in time. In this regard, the parents and the teachers have a special responsibility. Parenting that combines with high levels of nurturance and consistent discipline has been associated with lower risk of substance abuse. Some of the measures mentioned here would be particularly useful for prevention and control of alcohol and drug abuse among adolescents. See, what we are reading now is less likely to appear as questions. You will get questions related to specific drugs, withdrawal symptoms, what is a stimulant, what is a depressant, what is a hallucinogen, those kind of questions will come. But this reading is important just to complete this discussion. Getting the perspective. Avoid undue peer pressure. Every child has his or her own choice and personality, which should be respected and nurtured. A child should not be pushed unduly to perform beyond his or her threshold limits, be it studies, sports, or other activities. Same applies to you also. I appreciate you for sticking to the process, for putting your effort. I will celebrate whatever is your results with you. Okay? I tell my students, do what you are supposed to do. After the exams we will celebrate, don't bother about the results. When it comes, use it for what you have to use it further. Continue to grow, continue to do the right things. Gradually you'll keep improving. There is no choice but to excel. Excellence is a natural consequence of human pursuit. You have to do a lot of wrong things to not excel. But I want to excel today. We don't know, are you ready for it yet? Alright. Education and counseling. Educating and counseling him or her to face problems and stresses and to accept disappointments and failures as a part of life. Every adult knows that you are more likely to not achieve most of the things that you set out to achieve. Out of, in between hundreds of failures, you will have one or two successes. Those successes are the ones which people talk about. Failures are the ones which train you to become successful. So you cry about failures and you want only success, that doesn't happen. You are accepting of failure. Okay, something happened, something went wrong, somebody is affected, you are humiliated, accept it, keep moving. Don't take too much on yourself. It would also be worthwhile to channelize the child's energy into healthy pursuits like sports, reading, music, yoga, and other extracurricular activities. Now you see, sports will make the person physically strong. A physically strong person is more likely to handle challenges better. Reading makes the person intellectually diverse. Reading gives you multiple perspectives which will empower you to make better decisions. Music makes you develop mechanisms of going deeper into yourself and explore your own abilities. Yoga helps you develop physically, mentally, emotionally, spiritually. In all dimensions. These are all enhancing your abilities. Seeking help from parents and peers. Help from parents and peers should be sought immediately so that they can guide appropriately. Help may even be sought from close and trusted friends. Besides getting proper advice to sort out their problems, this would help young to vent their feelings of anxiety and guilt. You should encourage people to share the things that bother them. Suppression and repression are major causes of depression. Alright? If you keep suppressing your emotions and repressing your thoughts, you will get into depression. You should express your emotions, learn to express your emotions in a healthy manner. Learn to express your thoughts without bothering about what other people will think about it. Then you will find out ways to deal with everything. You are afraid of consequences, you are afraid of what people will think, you are afraid of what somebody else will feel about you. Makes you weak. Looking for danger signs. Alert parents and teachers need to look for and identify the danger signs discussed above. Even friends, if they find someone using drugs or alcohol, should not hesitate to bring this to the notice of parents or teacher in the best interests of the person concerned. You should not listen to your friend telling that, if you are my friend, don't tell this to everybody. I will tell this to everybody because I am your friend. I'll tell this to your parents and teachers or people who can stop you from doing this because I am your friend. I wouldn't have bothered if I was not your friend. Okay? to do what is right. Appropriate measures would then be required to diagnose the malady and the underlying causes. This would help in initiating proper remedial steps or treatment. Seeking professional and medical help. When the surroundings, when oneself, peers, friends, family are not able to help, there is professional help available. A lot of help is available in the form of highly qualified psychologists, psychiatrists, and de-addiction and rehabilitation programs to help individuals who have unfortunately got in the quagmire of drug or alcohol abuse. With such help, the affected individual with sufficient efforts and willpower can get rid of the problem completely and lead a perfectly normal and healthy life. Okay. So, this completes our discussion on human health and diseases. Most of the things that would be helpful for your exams, dealt with. Okay. With respect to help and support, one of the heroes of our childhood times, cricket hero. I saw his interview after a long time. He has not given an interview for a very long time. He is in very bad financial status. Socially he has gone down. I told you, I think I have told you about him, Vinod Kambli. About a week or so, about 1 or 2 weeks ago, he has given an interview after a long time. He has become a chronic alcoholic, probably has done drugs also. Physically very weak, he has got 2 heart attacks. He is of the same age as Tendulkar. Look at Tendulkar, how he is still. Vinod Kambli is almost like he will die, kind of. Now he has gone into rehabilitation. He is open about it. He talks about it. I did this things wrong. My friend Tendulkar helped me. Helped him get medical care and counseling. He says that I will go through this rehabilitation and I will come back stronger. So, don't keep cribbing about what went wrong. Don't keep crying about loss of reputation, loss of respect. Nothing, nobody bothers. Just try to get back to the best possible functional level that you can get back. So, see, microbes in human welfare and ecology is what we have to touch upon. No? Ecology is light, it is not very heavy. There are some important concepts, but we can do it up quickly. We'll try and do ecology. Alright? We'll try and discuss ecology. And finally, the last thing that we will do will be microbes and human welfare. Microbes in human welfare can be taken up fragmented, everything can be taken up in a fragmented manner, no problem. Alright? Okay. It is still the same thing. Nobody got it. Oh, you have not changed it. 134 was yesterday, no? Today it is 133. Like a movie. Earlier days, success of a movie would be measured in whether it did 100 days or not. So your movie is about to begin shortly. 100 days. 100 days is actual countdown. Then it comes to 100 days and from there it is countdown. There are 3 chapters, no? Organisms and population, ecosystem, and biodiversity. Biodiversity and conservation. See, there is hierarchy. There is biological hierarchy. What is biological hierarchy? Individual level. Starting with cells. Cells is the lowest unit of an organism. Then you have tissues, then organs, organ system, and the individual. Up to that is biological hierarchy. What is the ecological hierarchy that we have to study? A group of individuals is a population. A group of individuals belonging to a particular species is a population. Then next level is community. Next level is After community, you have, see, multiple populations can be there in a community, multiple communities can be there in a ecosystem. Then you have the ecosphere. There are in an environment you have living components and non-living components. So living components are called biotic factors, non-living components are called abiotic factors. Which level of hierarchy considers the abiotic factors also? In population, do we consider the abiotic factors? In community, do we consider abiotic factors? In ecosystem, do we consider abiotic factors? Yes. Ecosystem has both biotic and abiotic factors. Multiple ecosystems form the ecosphere or the biosphere. So biosphere across geographies. Can a particular ecosystem be discontinuous in geography? Can we have one ecosystem here in Riboy and the same ecosystem be in Shillong also? Can it be possible? No. Can we consider the ecosystem seen in Riboy and the ecosystem seen in Shillong as part of the ecosphere or the biosphere? You can see that, we can consider that one. Okay. We'll quickly do this. Our living world is fascinatingly diverse and amazingly complex. We can try to understand its complexity by, see, these 3 chapters will give you reasonably good number of questions also. Easy to remember, easy to get it right. There are not many complex concepts in these things. Very few concepts, we remember it, we get the answers right. That's all. Ecology questions are less likely to go wrong. We can try to understand its complexity by investigating processes at various levels of biological organization. Macromolecules, cell, tissue, organs, individual organism, population, communities, ecosystems and biomes. At any level of biological organization, we can ask 2 types of questions. For example, when we hear the bulbul singing early morning in the garden, we may ask, how does the bird sing? Or why does the bird sing? The how type questions seek the mechanisms behind the process, while the why type questions seek the significance of the process. For the first question in our example, the answer might be in terms of the operation of the voice box and the vibrating bone in the bird. Whereas for the second question, the answer may lie in the bird's need to communicate with its mate during breeding season. When you observe nature around you with a scientific frame of mind, you will certainly come up with many interesting questions of both types. Why are night blooming flowers generally white? How does the bee know which flower has nectar? Why does cactus have so many thorns? How does the chick spruce recognize her own mother? And so on. Okay. How and why questions are important to understand nature. That is what it means. Nothing in terms of what can turn out in your exam. You have already learned in previous classes that ecology is a subject which studies the interactions among organisms and between the organisms and its physical environment. Ecology is basically concerned with 4 levels of biological organizations: organisms, populations, communities, and biome. In this chapter, we explore ecology at population levels. So, organism and population is the chapter here. Next chapter is ecosystems, and then is biodiversity.